Asthma is a chronic condition that makes breathing a challenge. It causes inflammation and sensitivity in the airways, leading to coughing, shortness of breath, chest tightness, and wheezing. Common triggers like pollen, dust, and smoke can make symptoms worse. Even stress can trigger an asthma attack, making it crucial to know your triggers. Over time, if not well controlled, repeated inflammation can lead to long-term changes in the airway structure, making asthma harder to manage. Avoiding these irritants and following a personalized plan is key to help prevent flare-ups and keep you in control. Welcome to QuickM by Dr. Aid. This presentation will help you identify common asthma triggers and develop effective management strategies. Asthma is a prevalent chronic respiratory disease affecting millions globally. In 2019, 262 million people were impacted, with 455,000 deaths. In the U.S., 1 in 12 people have asthma. While it can develop at any age, it's most common in childhood. So, who is at risk of developing asthma and what happens in the lungs? Asthma can affect anyone, but it often starts in childhood. If you have a family history of asthma, allergies, or eczema, you might be at risk. Tobacco smoke exposure, especially during pregnancy or early years, can increase chances. Environmental allergens and air pollution are also culprits. Respiratory infections in early life can set the stage for asthma. Even obesity and frequent acid reflux can heighten your risk. In asthma, the airways become inflamed and overly sensitive. Triggers like allergens, cold air, or exercise can make it worse. This leads to narrowed airways, excess mucus, and tight muscles around them. Breathing becomes difficult, and symptoms can be overwhelming. Asthma triggers are categorized into allergens, irritants, infections, exercise, emotional factors, and medications. Common allergens include dust mites and pet dander, while irritants range from tobacco smoke to air pollution. We will start our discussion with house dust mites. Did you know your home could be a playground for microscopic creatures called house dust mites? These tiny dust mites thrive in our pillows, mattresses, and carpets, feeding on flakes of our skin. But don't worry, I've got some management tips for you. Tip number 1. Use allergen-proof encasements for your mattress and pillows. Tip number 2. Wash your bedding weekly in hot water, over 130 degrees, to keep them at bay. Tip number 3. Keep indoor humidity below 50% with a dehumidifier. Tip number 4. Remove or limit carpeting, especially in bedrooms, and use a vacuum cleaner with a HEPA filter to reduce mite reservoirs in rugs, upholstery, and curtains. To summarize, these microscopic creatures in our homes feed on skin flakes and can trigger asthma. Management includes using allergen-proof bedding, washing in hot water, and reducing humidity. Limiting carpeting and using HEPA filters can also help reduce exposure. Next, we will discuss our pets. Did you know that pet microscopic flakes of skin or dander, saliva, and urine can trigger asthma symptoms, not just pet hair? Cats and dogs are common culprits, but even rabbits and hamsters can cause reactions. Asthma flares can happen without direct contact. Allergens stick to clothes and furniture. To manage this, keep pets out of bedrooms and living areas to reduce exposure. Bathe and groom your pets regularly to minimize dander shedding. Use HEPA air purifiers to filter out airborne allergens and improve air quality. Consider removing carpets and heavy drapes that trap allergens, or clean them often with a HEPA vacuum. To summarize, pet dander, saliva, and urine can trigger asthma, not just pet hair. To manage, keep pets out of bedrooms, groom them regularly, use HEPA air purifiers, and remove allergen-trapping furnishings. What about roaches? Cockroach allergens, found in droppings and body parts, can trigger asthma, especially in urban areas. Management includes keeping living areas clean, sealing entry points, using covered trash cans, and applying insect control measures if needed. Another common trigger is mold spores. Mold spores, common in damp environments, can irritate airways. Management involves improving ventilation, controlling moisture, cleaning mold-prone surfaces, and disposing of moldy items. These steps help reduce mold exposure and asthma symptoms. Next, we'll delve into pollens. Spring and fall are beautiful, but they also bring tree, grass, and weed pollens that can trigger asthma. These seasonal allergens are carried by the wind, making them easy to inhale and causing airway inflammation. To manage your exposure, keep an eye on pollen forecasts and close your windows during high counts. After being outside, shower and change clothes to wash away any pollen lingering on your skin and hair. Consider using preventive medications like inhaled corticosteroids or antihistamines to stay ahead of the symptoms. To summarize, pollen from trees, grass, and weeds are seasonal allergens that exacerbate asthma. Management includes limiting exposure by monitoring forecasts, showering after outdoor activities, and using preventive medications like inhaled corticosteroids. What about our food? Can they trigger asthma symptoms? Certain food additives, such as sulfites found in dried fruits, wine, and processed foods, monosodium glutamate or MSG, artificial colorings, and flavorings, can act as asthma triggers in sensitive individuals. Effective management includes reading food labels carefully to identify hidden triggers like sulfites and benzoates, avoiding high-risk foods such as packaged snacks and processed items, maintaining a detailed food and symptom diary, and consulting an allergist or dietitian for personalized evaluation and guidance. Let's move on to exercise-induced asthma. Exercise-induced asthma can be a real challenge during physical activity. It's triggered by intense exercise, especially in cold or dry air. Symptoms like wheezing and shortness of breath can hit you 10 to 15 minutes after you start. But don't worry, I've got some management tips for you. Tip number 1. Use a reliever inhaler like albuterol or Symbicort 10 to 15 minutes before you exercise. Tip number 2. Always warm up and cool down to protect your airways. Tip number 3. Breathe through your nose or wear a mask in cold weather. Tip number 4. Keep your asthma well controlled with daily medications. To summarize, exercise-induced asthma causes airway narrowing during or after activity, worsened by cold or dry air. Management includes using a reliever inhaler before exercise, warming up, breathing through the nose, and maintaining good asthma control. Indoor and outdoor irritants are next. Did you know that strong smells, smoke, and fumes can trigger asthma symptoms? Things like smoke, cleaning agents, and pollution can irritate your airways. Indoor sources like household cleaners and secondhand smoke are common culprits. And outdoor irritants like vehicle exhaust and wildfire smoke can make it worse, especially in cities. Here are some high-yield management tips. Choose low-irritant products. Fragrance-free cleaners are a must. Improve indoor air quality by ventilating and using HEPA purifiers. Monitor outdoor air quality and stay inside on high-pollution days. And don't forget to wear a mask when exposed to irritants. To summarize, indoor and outdoor irritants like smoke and pollution can trigger asthma. Management includes using low-irritant products, improving air quality with HEPA filters, and monitoring outdoor air quality to reduce exposure on high-pollution days. In addition, avoid exposure to cigarette smoke by quitting smoking and ensuring a smoke-free home and environment. Next, can my workplace trigger asthma symptoms? Workplace exposures such as dust, chemical fumes, cleaning agents, flour, hair dyes, and disinfectants can significantly worsen or even cause asthma. This occurs especially among workers in healthcare, like those exposed to sterilizing agents such as glutaraldehyde, farming, where grain dust or animal dander is common, baking with frequent flour exposure, cleaning with irritants like bleach or ammonia, manufacturing with solvents and isocyanates, and hairdressing with hairsprays and dyes. These irritants may not trigger immediate symptoms, leading to a gradual onset and worsening over time if unrecognized. Effective management involves using protective equipment like masks and gloves, maintaining proper ventilation, tracking symptoms in relation to work tasks to identify triggers, noting improvement on weekends or vacations as a clue to occupational asthma, and seeking occupational health evaluation. Workplace adjustments may be necessary to prevent continued exposure and preserve respiratory health. Next, we will discuss weather changes. Sudden temperature changes can irritate sensitive airways, leading to bronchospasm. High pollution levels, smog, and ozone can trigger asthma attacks. Shifts in humidity and stormy weather can make things worse. Tip number 1. Monitor the air quality index. Use apps to stay informed and limit outdoor activities on bad air days. Tip number 2. Cover your nose and mouth when it's cold outside. Tip number 3. Stay indoors when pollution is high. Keep windows closed and use air purifiers. Tip number 4. Increase controller medications as advised during high-risk weather events. To summarize, weather changes and poor air quality can trigger asthma. Management includes monitoring air quality, covering the nose in cold air, staying indoors during high pollution, and using controller medications during high-risk conditions. Coming up is respiratory tract infection. Respiratory infections like colds, flu, and RSV can exacerbate asthma. Management includes staying up to date on vaccines, using controller medications, practicing good hygiene, and acting early on symptoms to prevent severe flare-ups. Can certain medications trigger asthma? The answer is yes. Medications like aspirin, NSAIDs, and non-selective beta blockers can trigger bronchospasm in sensitive individuals. A subset of asthma patients experience severe reactions to aspirin and related drugs, often with nasal polyps. Management tip: avoid aspirin and NSAIDs like ibuprofen if you're sensitive. Always review your medication list with your healthcare provider for asthma-incompatible drugs, especially NSAIDs and non-selective beta blockers. Use alternatives like acetaminophen for pain, and choose cardioselective beta blockers when needed. To summarize, certain medications like NSAIDs and beta blockers can provoke asthma. Management involves avoiding these drugs in sensitive individuals, reviewing medication lists, and using alternatives like acetaminophen when necessary. We will round up this list with conditions associated with asthma exacerbation. Gastroesophageal reflux disease can worsen asthma by allowing stomach acid to irritate the airway lining and is managed with lifestyle changes, weight control, and acid-suppressing medications. Emotional triggers such as stress or laughter may provoke symptoms, so relaxation techniques and psychological support are important. Allergic or chronic rhinosinusitis contributes to airway inflammation and is best managed with nasal corticosteroids, saline rinses, and targeted treatment of allergies or infections. Patient education is key in asthma management. Learn your triggers, use peak flow meters, and review action plans regularly with your healthcare provider. Empowering patients with knowledge and self-monitoring tools enhances asthma control and quality of life. Key points include identifying triggers, combining pharmacologic and environmental measures, and using inhaled corticosteroids for long-term control. SMART, using Symbicort for immediate relief and maintenance therapy, and other anti-inflammatory reliever strategies improve outcomes. Empower patients with knowledge and action plans for effective asthma management. To conclude, asthma is not just a lung condition, it's a complex mix of genetics, environment, and daily habits. Even the smallest triggers can quietly disrupt control. By understanding the 15 most common asthma triggers, we can shift from reacting to preventing. This proactive approach reduces symptoms and hospital visits, restoring quality of life. For healthcare providers, it highlights that personalized environmental control is as crucial as medication. Thank you for joining this presentation. Your engagement is appreciated. Please like, comment, and share this video to spread awareness and knowledge.